All right, let's also now get a view in from guests joining us on the program right now. We have with us Ashwajit Singh. He's Managing Director with IPE Global. Thank you for speaking with NDTV. Give us your perspective on how you see this Janata Curfew helping to fight COVID-19.
Thank you. I think the Janata Curfew is more about creating an awareness. It's a step in the right direction. It's about creating an awareness about the seriousness of the coronavirus. Also to acknowledge the good work being done by the health workers and the essential services staff as well. It's really there coming from the Prime Minister, call coming from the Prime Minister, popular lead like the Prime Minister. It's there to really motivate people to try and stay together in this moment of crisis. Having said that, I think it's a good first step or a good step, but it's far from what needs to be done. We need some more very drastic steps to be taken. This is a good gesture.
What are those in your opinion?
Frankly, I think we're really heading for a lockdown. It's an emergency or a warlike situation. 1 day's staying at home is not going to solve the problem. We really need to take more drastic steps. We should be looking at maybe 2 weeks of total lockdown. Nobody being allowed to step out of their houses other than the public health workers and the essential services staff. We've seen that happen everywhere in the world. And now with the private sector testing starting next week, I fear the numbers in India are very underreported till now. And once we get the private sector testing in place, I fear that the numbers are really going to shoot up over the next couple of weeks. And for us to be able to try and control that, we need to act now. We can't wait for another week, 2 weeks to really start acting. So it's really something we need to look at. We also, of course, have issues around economic issues. We have issues around medical issues. We don't have medical facilities. So probably we need to start cancelling the leave of anybody who's in the medical staff. We need to try and get back people who are retired. UK and some of the other countries have done that. We need to train the ASHA and the Anganwadi workers, the self-help groups to try and address this problem. And more important, we need to also decide what are we going to do for the daily wagers and the laborers. Because once you go in for a lockdown, yes, it might defer or control this disease to some extent, but then that's going to come up with more issues around the economic issues. So probably we might.
I think that's a very important point you're making, Mr. Singh. You know, for daily wage laborers and workers, even a day like today, for instance, would be, I mean, these are literally people who, you know, eat if they make money for the day. What kind of social security net do we now need to look at on a nationwide level? Yes, certain states have come out with announcements, including Uttar Pradesh just yesterday or so. But does there now need to be a national policy about what needs to be done in the event of a larger, longer lockdown?
Probably, yes. We should consider a number of issues as far as the daily wages and labor is concerned. We should be even ready to provide food packets if required, because the first issue is about survival. We can talk about economic recovery at a later stage for the corporates, etc. But today we're talking about survival of these people. So food packages, maybe using a direct benefit transfer. We've already got the Pradhan Mantri Kisan Yojana scheme, but even using the Jan Dhan accounts to try and get some money transfer to some of these people. And also assuring the corporate sector that they need to continue paying temporary and daily wages. Because a lot of people are laying off temporary wages right away. So the government needs to come up. They may not come up with the details of the scheme, but a broad scheme like the UK government's really said that they're going to cover 80% of the wages in case corporates really are unable to pay that. But maybe not as high as that. But we need to come up with this needs to be done in two phases. One is, what do we do now in terms of the next 2 weeks, and then how do we really look at economic reforms thereafter?
All right. Thanks very much indeed, Ashwajit Singh, for joining us and giving us your views on what the road ahead could hold.
Thank you. I'd like to just mention here that the problem is far more than what we think. I've spoken to friends in Italy, in Spain. There's so much of a stress on the medical facilities. The people are fighting over ventilators, fighting over, being hospitalized. And I fear that we are going to be heading for that if we don't go ahead and have a lockdown very, very soon. We've already announced the work from home for our staff.
But Ashwajit Singh, do you believe that, just a lockdown is enough, or should we be looking at this point at ramping up medical facilities in the best way possible also? Doesn't it have to be a holistic approach? I mean, for instance, China showed the way when a stadium was converted into a makeshift hospital. Do we need to now create more beds, more ICU units, have more ventilators available? All of this has to be really a combined response, does it not?
Absolutely. We need to get in, whether it's the army barracks, whether it's the hotels which are vacant right now. No hotel is doing well. Whether it's vacant flats or even certain wards of hospitals. We have to get the private sector and the public more involved in. Everybody needs to come up at this time. India has to be united beyond party lines, beyond religion, and I think we all have to fight this war against coronavirus together, and that's the only way we can do that. So it's not just one issue or one step that's going to resolve the issue, but a number of multiple steps at the same time need to be taken.
All right. Thanks very much indeed, Ashwajit Singh. Appreciate your being with us. All right. Let's